A very good morning to sir. So our group today, LINAC, will be starting off our project by entitled The Essential Skills Vital for Employability of Fresh Graduates in the Field of Radiotherapy. Now I'll pass off to my teammate to start off with introduction.
Good morning, sir. My name is Jenny. So I will present about the statement of problem and also the objective. So the first problem statement is, what are the skills acquired by the fresh graduate in the field of radiotherapy to fulfill the future employment market? The first skills is reflective skills. Reflective skills is where we learn from our past experience and we find a best solution to solve the problems. The second one is generic skills, which is very general skill which involve problem solving skills and also other soft skills. The third skills is communication skills. It's very important for fresh graduates as we have to communicate between patient, radiologists and other medical health staff. The last skills is managerial skills, where we have to manage a team and do some related paperwork. Our second problem statement is, why is it so important to acquire the skills in the workplace? Reflective skills is important in such way that it can monitoring our daily practices and also encouraging our professional growth. It enables us to become more competent in those areas where practice requires creative thinking, critical reasoning and also contextual understanding. The second one, the generic skills, is important as it consists of our personal skills, communication skills and also problem solving skills. The third one is communication skills. Why is it important? Because we have to convey accurate and correct information to our patient or from radiologists to patients. With a good communication skills, we can decrease patient anxiety level and also increase the confidence level of patients toward us, radiation therapists, and enable them to cooperate more with us. The last skills is managerial skills. It can ensure the effectiveness of our workflow in the radiotherapy department. So the third problem statement is, how can current radiotherapy students prepare themselves for the future employment market? Nowadays, employments have a high preference toward graduate with strong academic background and also equipped with some extra skills such as the skill I mentioned just now, and also consultation skills. It's important because we have to elicit and respond to patient emotional cues. And the last one, why is it the managerial skills is important? Because when we equip with that skill, we will be given a task on managerial tasks, and also it can reduce the overall human resources because we are the one who understand about the complete workflow of the department. So why don't we equip with these skills so that we can handle our team? So next I will continue to our objective. Our research project have 3 objectives. The first is to identify the skills. The second one is to determine the importances of these skills, and the third one is provide recommendation for the current radiotherapy students, how can they prepare for the employment market. And next I will pass to my teammate for methodology.
Good morning, I'm Yingzhen and I will present the methodology part for our project. Our project is in a qualitative study form, so we distribute open-ended questions to collect data from a small number of subjects. For the interview parts, we select 1 hospital for interview, and for the questionnaire part, we distribute to 10 to 30 individuals. The selection of participants. We select the participants from the prospective workplace for radiotherapy graduates. The hospital we select for interview are in a manageable distance from UKMKL campus. We identify the workplace through internet and contact them via email for the participation in this study. The individuals that participate in this study are holding a job prospective for radiotherapy graduates. We approach in person for participation in this study. For data collections, we interview the head of department of KBJ Damansara, which is Encik Zulkifli. The questions covered in the interview are the skills required for the fresh grads in radiotherapy field, the importance of the skills and advices on how the radiotherapy students can prepare themselves. The interview questions are given in advance and the interview sessions are audio recorded and then transcribed. For the questionnaire part, we distribute the questionnaire through WhatsApp. The questions covered in the questionnaires are more or less the same. The skills required for fresh grad, importance of the skills and advices on how they can prepare themselves in future market. For the data analysis, the interview part, we pick out the point from the transcript and summarize it. For the questionnaire part, we tabulate the responses and summarize the result too.
Good morning, sir. I'm Kurui Kwan. I'm presenting the scope in this project. For the part of participating establishment, the company that agree to participate in our research is KBJ Damansara Specialist Hospital. The location of this hospital is at Petaling Jaya, Selangor, which is 20 minutes from UKMKL. The radiotherapy department in KBJ Damansara Specialist Hospital was established in 1997 that had evolved from conventional facilities that cater to the latest treatment procedure. For interviewee, the company officer who offered to be interviewed is Encik Zulkifli, who is the head of the department, the radiotherapy department in KBJ Damansara. He has working experience of radiotherapists that more than 10 years in KBJ Damansara Specialist Hospital. The interview was done on 17 April 2019. For the questionnaire respondent, the range of the respondent is between 24 to 38. And for the gender, there's 6 females and 1 male. For academic qualifications, there is 1 with diploma and 3 with bachelor's degree and 3 with master. Next, I will pass to my teammate to present the finding part.
So very good morning to sir. I'm Lizzie Zwan and I'm going to proceed with the findings, which is the interview session. For interview session conducted with Mr. Zulkifli, we have divided into 3 parts. One is on the employment skills requirement, recruitment, and also the skills required for the preparation of the students for the employment market. So in terms of the employment skills requirements, some of the findings we can find through the interview, first of all, is the communicating skills and also self-personality. Where applicants' proficiency they are in English, they are usually graded during the interview session, as the skill is greatly emphasized due to our everyday handling with patients. Because in terms of communicating skills, it's usually the most important factor in this field, because other than just handling with the patients, with direct handling with the patients, we are also going to communicate and also handle with the consultants. So consultants, they are usually foreigners, especially in private hospitals, so it's important for us to emphasize on the importance of this proficiency in English so as to have no misunderstanding in terms of communication. Second is having empathy, which is like the importance that we have to sometimes do something beyond our job, whereby for instance, it could be just comforting some patients who come in who might be anxious because it's their first time undergoing radiotherapy treatment. So having empathy is also one of the skills actually required in this field of radiotherapy. Next point will be in terms of stress management. Of course, we know stress management is something very common in organizations, in companies, but in hospital, particularly in this field, one of the stress management that we have to go on is in terms of the machinery breakdown. Because when there's a machinery breakdown, we're not just going to handle with the top management when we have to report to them on the machinery breakdown, but also when we have to deal with patients. In what way? It's because patients, they come in for radiotherapy, they usually come in every day, 5 times a week. So what happens when there's a machine breakdown is that we have to drag the appointments back to behind. So when this happens, some of the patients tend to be anxious. So this kind of stress management, we have to get ourselves prepared with as one of the skills in terms of employability. And fourthly, it will be in terms of reflective skills. According to Encik Zulkifli, reflective skills also, they call it as continuous learning, whereby say there's something bad that happens, normally they will undergo this thing called a root cause analysis, following an accident, which is to identify the cause of problem and then find out the solution or outcome to it. So From there, they will reflect on the actions, normally bad actions, and then from there they will learn how to overcome the problem to prevent any future same problems that might occur in the future. So in terms of the recruitment part for interview session, there's some of the aspects that are looked upon by the head of department during interview sessions. Although it's not exactly important, but height requirement is something that Inches Security will actually look upon when it comes to interview sessions, because in radiotherapy field, other than just delivering the treatment to the patients, sometimes you have to consider the setup itself, because we as radiotherapists are responsible for the setup of the entire treatment before we actually deliver it. So in terms of the placement of heavy equipment to the machine, sometimes it will be at a certain level of height. So this aspect, height requirement, is actually quite important to ensure the safety of the patients and also the staff themselves. And other than that, second will be communicating skills, like what I have mentioned just now. Other than just handling with the patients, we are also communicating with the consultants. So recruitment, they'll look at communicating skills as well. Thirdly will be personality, because despite excelling academically, some applicants that do not work well with people. Like in this field, we'll be working mostly with people. One, we'll be working with patients. Secondly, will be that this field requires our teamwork among radiotherapists, because you will not be working alone in this field. Instead, you'll be working in a way that one will probably position the patient, one will be in charge of couch positioning, and another one will be in the console room. So we are actually constantly working in a team. So it's important that personality becomes one of the scope or aspect that we look upon in the interview. And fourthly will be in terms of knowledge. Inches also mentioned about the importance of knowledge, where having a strong grasp of knowledge in this field will directly affect one's confidence and ability in solving problems. Like knowledge is like a base to everything. As long as you have the knowledge of a strong foundation in this field, it's going to help you to go further. Like for example, when the problems occur, then you will, with the knowledge, you have the confidence to overcome the problem. So again, knowledge is the base to everything. So the last part of our interview session, we concentrate on the student preparation for the employment market. First, resume, which is the most common thing. As usual, we should know that keep it as short as possible while limiting it to a maximum of 2 pages, and include only necessary details, which is something really common that we should take into account. And for interview session, make sure some homework is done regarding the job prior to the interview session. Dress up in appropriate attire, display confidence, and avoid being nervous during the session, because according to Inches most of the graduates or job applicants that came in for interview, they are usually nervous. He said that it's important for you to display confidence, whereby no matter what kind of questions given, even if you're unsure about the topics given, just answer confidently, because what they're looking at is not the way you answer questions, but it's actually the confidence in you in answering it. And also, expect to be asked on questions beyond our field maybe, because according to Inchi again, some of the questions that might be expected might be the minimum salary required by you, and maybe what can you contribute other than just in this field. So these kind of questions should be expected by us as well. And lastly will be advice for student preparation now. Like us right now, university students will be going through clinical attachments. So some of the advices given by Mr. is that we have to perform well during clinical attachments, because clinical attachment is not just as a knowledge for us, but it also guide us through maybe in terms of recruitment, because if we do well in clinical attachments, it's going to leave a good impression to the medical staff there, and it could maybe further help us in terms of the recruitment by the particular hospital in the near future. Next, I'm going to pass off to my next teammate to talk about the questionnaire findings.
Good morning, sir. I am revising and I will explain about Part B, Part C, and Part D in the questionnaire. So we in the Part B, we aim to identify the skills required by the fresh graduates who will be working in the field of radiotherapy in the future. So from this graph, we can see that majority of the respondents agree that most of the skills that requires by the fresh graduates are decision making, management, motivational, critical thinking, problem solving, and some other else. But we have to concern about one statement that are leadership. Out of the 7 respondents, there are 4 respondents is neutral with this statement. It may be because that sometimes radiotherapists usually works by alone due to the shortage of the manpower, and there will always be a senior staff or supervisor or the head of department will be leading the team to treat the the cancer patient. So now we proceed to the section C. In section C, we aim to determine the importances of skills required by the fresh graduates who will be working in the field of radiotherapy. So in this graph, we can see that statement 8, which are innovative and creativity is needed by fresh graduates in the field of radiotherapy. For this statement, there are 6 respondents who feels neutral about this statement. It may be because that the radiation therapists have to follow strictly about the standard of the procedure SOP to treat the patient. They cannot simply alter or change the standard parameter to treat the patient in order to avoid adverse side effect to the cancer patient. So for the other statement, majority of our respondents agree with the statements. Now we proceed to the section D. In section D, we aim to identify the skill required by the future fresh graduates who will be working in this field. So for our summarizations, the skills that are necessary in order to perform well in this field are radiotherapy and planning technique, critical thinking, efficient communication, social skill, and stress management. For the question 2, the skill that the respondent wish the fresh graduates that to be more fully equipped with before entering the working fields are communications, social skills, stress management, English language, and clinical practice. For the question 3, the advices given by some respondents to the future graduates to help them in job searching process as well as in adapting to and performing well at work are: be passionate in the job, be humble, manage your stress wisely, be confident, and good in both academic and practical results. And now I will pass to my teammates.
Good morning, Doctor. My name is Sasha Sarvita, and today I'm going to present on the conclusion and recommendation for my group's mini research. So, in conclusion, from this mini research, we have learned a lot about the essential skills required by the fresh graduates in the radiation field. So, firstly, in terms of employment requirement, from this research, we are able to provide a guideline for the future graduates in the field of radiotherapy on some of the requirements emphasized by the employers. So now, in terms of the soft skill, we also can conclude that decision making is also a crucial skill needed by the fresh graduates in the field of radiotherapy, as critical thinking is required when they make daily decisions when they are handling with patients. So next, radiation therapists should also learn to manage their stress. This is because on a daily basis they always encounter a lot of challenges when they are working in the field of radiotherapy. So next, in terms of recruitment, good communication and also confidence level in terms of one proficiency in English still remain as one of the most crucial part focused by the employers when they are interviewing the job applicants. So lastly, in the aspect of student preparation for the employment market, firstly, a typical resume should only focus on the background, the skills, and also the accomplishment of the applicants. And next, it's also advisable for the applicants to keep their resume as short as possible and only including all the related matters and limiting the resume to a maximum of 2 pages. And lastly, learning as much as possible during their clinical attachment is very important, as it gives themselves the chance to equip with the skills they need as a radiation therapist. So next, now I will talk about the recommendation that we have for the fresh graduates in the field of radiation therapies. So we have a few recommendations for the fresh graduates based on our findings, our questionnaire and interviews. So the first recommendation is, before entering the field of radiotherapy, the students should be fully aware and understand the expected requirements to be employed, and also they should familiarize themselves with the environment of the radiotherapy department when they go for their clinical attachment. Next, when applying for a job as a radiation therapist, it is important that the resume handed in follows the advisable guidelines suggested, such as they should keep their resume they should keep their resume limited to the maximum of 2 pages. So the third recommendation is, during a job interview session, adequate preparation should be done by the candidates, and they should expect questions beyond the field of work. So for such, for example, like they should not only focus on the knowledge about radiotherapy, but they should also focus on other general knowledge general knowledge. So lastly, when working as a radiation therapist in the future, one should always be humble and also constantly willing to learn and always passionate towards their job, other than just equipping themselves with all the skills we have mentioned earlier. So for the individual reflection part, my name is Lizen again, and the most meaningful lessons I've learned from this project, first of all, is the importance of communicating skills, particularly one's English proficiency and the confidence level working in this field. Like from my findings I've mentioned just now, communication skills it remains as the most important aspect in this field of radiotherapy, because we are handling with the patients and also consultants. Consultants could be foreigners from countries like Western countries, so it's important to maintain proficiency in English as one of the prime factor in working in this field. Second, knowledge as the base that will guide us into mastering the rest of the skills. Knowledge, again, having a strong foundation in this field is going to guide us further, because as long as you have the knowledge, you have the confidence in doing whatever it is, and so it's not a problem. As long as you have the knowledge, you'll master the rest of the skills. And thirdly, be performing well during clinical attachments as preparation for employment market. It's important, what I've learned is that it's important for us to realize the importance of these clinical attachments as university students right now going through clinical attachments, because it's not just going to be as a strong baseline for us to gain knowledge, but it also could be more of a recruitment opportunity for us in the future. And lastly, I'd like to thank my teammates for their cooperation in bringing this project into success. Thank you.
My name is Jenny. So the most meaningful lessons that I have learned from our project is the importance of the skills and other than academic qualification. Academic qualification, when we get a higher CGPA, is really important. But without those skills required, we cannot perform our tasks well, and also the patient care. Before this project, I did know that the skills, for example, communication skills, the managerial skills, and also the generic skills is really important. But I don't know how important is the skills can help us in doing our daily job. The second lessons that I have learned is that the skill that I should require as a future radiation therapist. The communication skills, in order to increase the confidence level of patient toward us, we have to convey the information in such a confident way, and we have to convey the information as accurately, equipped with our knowledge, and also to enable patient to cooperate well with us. So the third lesson that I have learned is how should I prepare myself for the future employment market. I will prepare myself in a way of communication skills where eye contact is really important. The next is the managerial skills on how should I write a proper report with a proper format, and also the generic skills with reflection skills, solving the problem and learn from the past experience. So lastly, I want to say thank you to my teammates for cooperation and finish this project, and also to our lecturer who helped us a lot.
My name is Guri Kwan. There is three most meaningful lessons that I learned from this project. For the first one is it's important to have a good communication in English command and high confidence level in this field, as sometimes we as a radiotherapist need to consult the patients. And for second, having a good stress management to deal with the stress that may come from any aspects. For example, from the management, for the machine, and also the patient. So we need to have a good stress management to dealing with it. For the third, doing well during clinical posting to prepare myself to the employment market, because it's only the chance in clinical posting we can familiar with the environment and learn the skill that we need to be equipped. Thanks to my teammate to helping me and cooperate to finish this research, and also thanks to the lecturer who helped me a lot. Thanks.
My name is Sasha Sarvita, and for my individual reflection, The most meaningful lesson I've learned from this project is, firstly, it is important to know the essential skill required by fresh graduate. This is so because only when we know the essential skill required by fresh graduate, then only we can prepare ourselves better for the employment market. So the second most meaningful lesson I learned from this project is, it is also important for the fresh graduate to equip themselves with all the skills. It is no point if they just know and learn about the essential skill but don't equip it to themselves. The reason why they have to be equipped with all these skills is so that they have a better chance for employment after graduating. So the last most meaningful lesson I've learned from this project is, it is also important to perform well and leave a good impression at all times during their clinical attachment. This is because when we leave a good impression and perform well, then there might be a chance that they would want to hire us, or they would scout us after graduating. Lastly, I would like to thank all my team members for giving good cooperation throughout this research. And also, I would like to thank our lecturer for giving us the chance to conduct this mini research. Thank you.
Good morning, sir. I'm reminding for the individual reflection, the most meaningful lessons that I learned from this project is academic performance is not the only one criteria for a fresh graduate to be employed in the field of radiotherapy. Furthermore, they need to prepare themselves with many soft skills such as critical thinking, time management, and the others, and also need to improve their English proficiency level, as they need to communicate well with the patient and the staff. So for the last part, the resume and the performance during interview also play an important role for a fresh graduate to be employed in this field. Lastly, I would like to thank my teammates for giving full cooperation, and thanks to the lecturer for giving us this meaningful research, as we can get a lot of benefits from this research. Thank you.
My name is Yingzhen. So for the individual reflection, the most meaningful lesson that I have learned from this project is the importance of soft skill needed in our working field. So as we know, the academic qualification doesn't prove that you are a good radiotherapist. So you have to prepare yourself in the working field. You have to have all the skills needed, like communicating skills, like critical thinking skills, and all that. You have to treat patient nicely. So that is not covered in the academic qualification. So next is work as a team to finish a project. So for this mini research, I cannot finish it on my own. Thank you for every teammates. Then the knowledge needed is not only learned in class, as Encik Zulkifli said and our teammates said. So we have to perform well in the clinical attachment, our clinical posting. So during the attachment, the radiotherapy in the working field will teach us many things that we cannot learn in our lecture, that is not covered in our lecture notes. The knowledge needed is not only learned in classes. So as Encik Zulkifli said, prepare yourself and perform well in the clinical posting. During the clinical posting, the workers in the working field, the radiotherapist there will teach us many things that we cannot learn in our lectures, that we cannot learn in our class. So finally, thanks for everyone who contribute in this project and make the project finish smoothly. Thank you.